Hello. This is Layla, and I'm Amy. Layla, say hello.
Hello.
Hello. And welcome to Education in Motion's MAT assessments for pediatrics. Today we've enlisted the help of Layla, and she's going to help us demonstrate how to do a pediatric assessment, both supine and sitting. First of all, Layla, how old are you?
9 years.
Nice. When's your birthday?
2010.
So she's born, yeah. So you were born in 2010?
Yeah.
Yep. And 9 years old. Very good.
Yeah.
So today we're trying to figure out what the best posture is for Layla. So we're going to start with the supine assessment. So what we want to do is sort of see how she moves into supine, and then start with the pelvis, and then move down to looking at range of motion and the effect of that range of motion on any spasticity. Can you lay down for me with your head on this end?
Lie down.
Yeah, put head right there.
Okay.
It's really important to watch how she moves, what she can do, and what sort of tone that might ensue. Yeah, comfy? Comfy? I'm just going to bend up your legs. Yep. And what we want to do first is just see how symmetric that pelvis is. So with children, it's easy to find their ASISs. I'm a little bit more invested in symmetry. So I'm going to go ahead and try and find where the ASISs are, where her iliac crest is. Make sure that pelvis is as neutral as possible. All you got to do is relax. Have some fun. Yeah? Okay. So I'm going to go about where I think those ASISs are, and then I'll go underneath and try and find the ASISs. Should be a little hook there, and indeed, there I can feel them sort of a little bit higher than the rest of the pelvis. What I want to do is make sure that they are even from left to right. That'd be a rotation. I want to make sure they're even from inferior to superior. That would be a pelvic obliquity. And then I'd also want to make sure that I don't have a big arch in her spine or a big flattening of her spine, because that would indicate a posterior or an anterior rotation. So if I go back, nice and still for me, Layla, as best you can. Yeah, I'm going to see where those ASISs are. They are level from side to side and up, down. Then I can also take underneath. You relax. You just relax your bum straight down. Showing us how well you can bridge, hey? Nice. Can you bring it back down? Yeah. Can you bring your knees into your chest? Can you bring these into your chest? Bring them right out to your tummy. Can you bring them up into your tummy? Wow. And then can you bring them back down? Nice. Very good. You're a very strong girl. I want to see whether I can move her into that anterior and that posterior position. Here I can see actively that she's able to do that rotation by herself. I can see that it's happening. I also know she can assume neutral. Bring that bum right down to the mat for me. Next thing I want to check is whether there's movement laterally. And again, she's got lots of movement, and it can come symmetric. What I would want to do is, if I was moving the pelvis and all of a sudden I got a lot of trunk movement, scoliosis, rotation, leaning, I'd want to make sure that I knew the effect of the pelvic position on the trunk position. Here I can create a really nice symmetric position, so I know it's possible. Next thing I want to do, I've already seen the active movement into flexion, so she's got plenty. I've also seen the active movement into bridging. Bring your bum up again for me. Way up to the sky. Okay, so if you can get that active mobility, definitely look at it. I'm also helping her stabilize a little bit at her knees, but I can also see that she's got that control there. All the way down. Boom. Okay, so even though we've seen that actively, just for our purposes of training here, I would take one leg and get back onto that ASIS and bring it up. I want that amount of hip flexion for my wheelchair. Do it a couple times. See what kind of tone, spasticity, abnormal reflex you get. Any sort of flexion up at the trunk, make sure that you're noticing that and trying to avoid it. If you can keep the non-tested leg bent like I am here, that's better because it's not affecting the position of the pelvis. And then now I'd like to look at hamstring range. She's going to have plenty. I want to just see how much hamstring range she has without having any movement at the pelvis. The minute you see movement happening at the pelvis, that means you've exceeded the length of that hamstring, and now you're pulling the pelvis into the posterior tilt. Okay, obviously we've got plenty here. We do have just a little bit of active movement plus a little bit of spasticity, sort of dystonic movement happening. So just pay attention there. But my range of motions are plenty for that good seated posture. Look a little bit at external rotation. Look at internal rotation. Look at abduction, adduction as it relates to midline. Make sure you do that same activity on the opposite side. Now I'm going to try and stabilize this one with my body and look on the left side. Flexion. Good. Internal rotation, external rotation, abduction, adduction. Look at hamstring range. I'm also looking at that pelvis, making sure that I'm not pulling that pelvis into posterior rotation or creating any compression, any scoliosis in that trunk. Okay, from that supine assessment, I know that I have really good pelvic mobility. It can come to neutral. I have plenty of hip flexion, plenty of hamstring range. I can see that within her AFOs here, I have 90 degrees of plantar flexion, dorsiflexion. Okay, now we've taken off Layla's AFOs. You can see she has high-level AFOs with sole insert in both of those. And those are really helping her maintain her dorsiflexion, manage some of the dystonia that she finds in her lower limbs, left greater than right. So if we then look at range of motion and even some spasticity, we'll see that we're shy a little bit of dorsiflexion and it's really tending towards eversion. So those AFOs are really doing quite a nice job for Layla. Okay, so that's left. Limited 20 degrees without those AFOs on. And on the right side, we have full plantar flexion. Okay, now we move to the sitting assessment. So first step is Layla's balance. She can sit unsupported. Sit up nice and tall for us, Layla. How tall can you sit? Up nice and tall. So lots of self-correction at her pelvis, lots of self-correction at the trunk. Okay. If she couldn't do that, maybe she's propping. Notice posterior propping, anterior propping, or if I'm having to offer full support. Okay. Often in these sitting assessments, I'll want another partner just to help me with correction of the pelvis or for stability reasons. So Tilly is going to help us here. Typically, I will stay on the mat, and then that second person can be on the front, either on a rolly stool, on a chair of some sort, or because we have a pretty good setup here with a mat table, Tilly's just kneeling in front. Do make sure that Layla here, her feet are grounded. We just have her on a stable toolbox, a seat cushion, or a little step stool all work well, just so that she feels grounded. She's getting sort of support from the world and helps her understand where her body is positioned in space. Okay. So next thing I want to do is just see whether I can foster a more upright pelvic position. I see how she will sort of deteriorate into a posterior pelvic tilt, some thoracic kyphosis, collapse there. Try and sit up nice and tall for us again. We can see that she can self-correct. So we know that that is available to us. Now where can I offer those supports? Also, if we were to have seen any pelvic obliquity, something like that in the supine assessment, I would alter that before I work on the anterior posterior dimension. We'll show you that from the front because that might be a little bit easier to see. So for our purposes here, I'm just going to offer a little bit of support at that pelvis. Make sure that you're not too high. You really want to be on that pelvis, making sure that that's nice and upright. Look at how some correction we get at the trunk. Look also at the head position. You'll know that we've gone maybe a little bit too far forward if all of a sudden we get sort of a neck extension sort of posture, or she's having to hold herself up. And so we're just trying to create that nice midline position. Really what we're trying to do for Layla here is create a nice stable trunk so that she can use her arms for all the functional purposes she needs them, for pushing a wheelchair, for writing, for all the stuff that she's going to be doing in school today. Okay. So now I've got that pelvis a little bit more supported. Now Layla, can you touch the top of your head?
Huh?
Yeah. Yeah. Can you do both sides? Good. Can you reach out and touch Tilly's hand?
Yeah.
Both sides. Okay. So what we're looking for here is, can she go outside of her balance of support, dynamic balance? Can she self-correct? And what sort of postural tendencies does she have when she does it? And again, she's going to sort of come into a posterior tilt when she does that. Also seems to have a tendency to come to that right side and feel it a little bit. Okay. So here, up nice and tall for us. Giving her that pelvic support, and then also looking at where I might want that back support. How high do I want that back support so that she's nice and stable? And also what sort of lateral trunk support might help her stay nice and stable at her trunk. Just enough so that she has plenty of freedom of movement, but has that stability so we can use those arms for functional purposes. Again, we're pretty invested in creating a nice midline spine. So we want to make sure that she's well supported so we can start to really make sure her posture long term is good, functional, creating those normal curves, but also giving her the flexibility for movement. Okay, now we've moved into the Frontend position so you can see any frontal plane asymmetries. And we see just a small little bit of a tendency towards a pelvic obliquity on her right side, naming that by the loci. Now, if I wanted to correct that, I would use a pelvic obliquity buildup, just pop it underneath that loci and see what sort of happens at her trunk, what happens functionally. I'm just going to sneak, and Tilly again is going to help us. Just Layla lean a smidge towards Tilly and see if we can pop that underneath. And then we'll again just see what might happen. Iliac crest, much more level. Look for tone differences, look for movement differences. Can you reach out and touch Tilly's hand again? Look for dynamic balance. Nice. How about the right hand side? Okay. Also look for, when she's moving, do you see a postural tendency? Do you see more collapse in that direction? Okay, whatnot. But I think we would absolutely try and add a little bit of a pelvic obliquity buildup underneath that loci. And then we also feel, probably more than you can see on camera, a little bit of a pelvic rotation, just a little bit forward on that right-hand side. So we would need to think about, within our backrest, can we support that right pelvis coming forward and the left pelvis coming back? Okay. And then this is also a really nice place to look at where we would put the lateral supports for Layla. Obviously you can see we've got a really nice midline position here, but we want to help stabilize that trunk. So nice lateral hug within our backrest. We'll give her that trunk stability and then opportunity to use those hands functionally. So with Layla, she gave us the opportunity to show a supine assessment and then move those findings into our sitting assessment, where we can determine what's practical to do and then try and translate that into the actual equipment, which we'll do in a later segment. For now, what we found with Layla is we have a dystonic CP. We found that we had some higher tone, left versus right, quite a bit down at the ankle. Dorsiflexion was inhibited. We also see some posterior pelvic tilt, a postural tendency towards an obliquity to the right, a little bit of rotation forward. We know that all of these are reducible. Metric posture. So for now, we'd like to say thank you for watching, and thank you to Layla for participating and being such a great demonstrator today. Bye-bye. We'll see you next time.
Goodbye.
See you from Australia.
Bye.
Bye.